this is Dr. Jayalakshmi, Mithran Dental, Adyar, Chennai. Why and when does a tooth need a root canal treatment? Tooth pain is something which is very terrible pain which one could have experienced, especially if at all the tooth pain happens to be at night and wherein you cannot go seek for any kind of medical help. But why does this generally happen? If you look at the tooth chamber, it is quite a unique structure. It has two layers of calcium in it, and inside which there is the tooth nerve and the blood vessels. That is, the tooth nerve and the blood vessels are encased by the calcium layer in the tooth. Whenever the bacteria starts destroying the tooth, it first penetrates the calcium layer, and that is when the cavity starts appearing. So if in case we ignore this cavity, we don't get it filled, it goes further deep and starts touching the tooth nerve. So the bacteria now, after it starts to touch the tooth nerve, it starts to destroy the tooth nerve, wherein you start with pain. As soon as these bacteria enter the tooth nerve, they just degenerate the tooth nerve, and these dead cells block the blood supply to the tooth. So from there on, even the body's immune cells could not reach the tooth. That's when the infection starts flaring up. Either it could be a persistent pain, later there will be a swelling in the region of the tooth, that is in the gum region of the tooth. To intervene this process, to stop this process from further progressing, is what that you do a root canal treatment. A root canal treatment is generally done to break this process and to help the tooth retain in its position. What we generally do in root canal treatment is that first we clear the cavity, that is the tooth chamber, the tooth nerve, and wherever the infection has happened, all those places. Even the canals inside the tooth is being completely cleaned. That is the reason it's called a root canal treatment, and it's been packed with a inert material. So the tooth is being saved from getting removed. So this root canal treatment you can understand from few of the signs that which you undergo. If in case you have a persistent pain, or if you have a overnight pain, or whenever you take food and that's when you start with pain, or a strong sensitivity to hot or cold liquids, all these are simple signs that the tooth needs more attention than rather a filling. However, get yourself checked with your dentist to know what is right for your teeth. Thank you.